As we first reported Tuesday, clinical trials for FDA-approved Addyi, or the so-called pink pill to increase a woman's libido, were done in San Diego. Joining me with how the prescription pill works, health implications, and who should and shouldn't take it are my guests, Dr. Irwin Goldstein, Director of Sexual Medicine at Alvarado Hospital, and marriage and family therapist David Peters. And Dr. Goldstein, you did clinical trials of Addyi here in San Diego. How does this so-called pink pill actually work?
So we did clinical trials and we found it to be double-blind, placebo-controlled. You didn't know how it was going, but then we opened it to open label, and then we really got a glimpse of how it worked.
And how does it work specifically in the body?
It stops women from having this horrible condition of no interest, they're not involved, they're not receptive. It changes brain chemistry. It lowers the inhibitors and it raises the excitors, so it rebalances their interest.
And so you're talking about this low libido and sexual interest. So specifically medically, you're talking about a certain condition, or are you just talking about women are grumpy and tired and don't want to have sex?
Right, so there's a specific definition called HSDD, hypoactive sexual desire disorder. It's persistent and consistent. It's absence of thoughts, fantasies, interest, and responsivity to sexual activity and willingness to participate. That is causes them bother and distress and partnership distress, and it can't be explained by an unspecified medical condition.
So how much from this clinical trial, how much can a woman expect her libido or sexual experience to improve?
Well, significantly, such that they're really happy and they're now able to not avoid the event and hide and be duty sex. It's very successful, I have to say.
Yeah, I think I read that it involved one improved sexual experience or satisfying sexual experience a month.
The problem with the term satisfying sexual event is it's a counting way that was invented by the FDA to assess efficacy. When you measure desire by desire scales, it's very effective and far more statistically significant than placebo.
Okay, and David, now this pill we were talking about changes chemicals in the brain. I understand it decreases serotonin and it increases dopamine, the pleasure pill. How much of a role does the brain play in sexual desire?
Well, the brain plays an enormous role. Sexual desire is experienced in brain function. And for women who truly have hypoactive sexual desire, this can be a great relief and a great joy. For those, I think the key is who truly has hypoactive sexual desire and who may not. I see a lot of clients coming in who complain about lack of desire, and after about 5 or 10 therapy sessions, I find there's issues in the relationship, issues in their perception of themselves or the perception of their spouse that are significantly impacting their desire. So the key is accurate diagnosis. This pill's not for everybody who just wants to have better sex. In our commercial world, there's a risk of overselling.
Sure. Do you see a downside to this, though? And my key on this is the serotonin. We know that antidepressant drugs actually raise serotonin levels. So could there be some competition here between depression or other psychological treatments and this prescription?
Well, it is interesting that one of the major drawbacks to antidepressants that work on serotonin is raises serotonin levels and wipes out your libido. Now you have something to be depressed about. But with this medication, it's lowering serotonin levels, and if that allows for increased arousal for a woman who really, under the best circumstances, still doesn't have desire, that's fine.
I see. And Dr. Goldstein, what are the major side effects to this pill, and who should and shouldn't use it?
So drugs that work on the central nervous system tend to have common side effects: somnolence or sleepiness, drowsiness, fatigue, nausea. Very minimal in most of the women experience. Very few people drop out because of side effects. The benefits are so useful, and this is such an amazing opportunity for women to finally get a medical treatment.
Sure. So can pregnant women, people who have had cancer, it's not a hormone, maybe postmenopausal women, is it open to all women?
Well, it's indicated for premenopausal women with the HSDD, but we studied it. The FDA required us to study a very large trial in postmenopausal women, and it's safe and effective and very useful in that population.
I see. And we're running out of time, David, so I do have to ask you this. Your advice for women who are concerned that their libido or sexual experience is low or not at a healthy level?
Yes. Well, the key is accurate diagnosis. The assessment has to be thorough. Luckily, in this case, allowing this medication, the FDA has required extensive training for the doctors to assess critically what the need really is. If this were released as many other medications with any general practitioner being able to prescribe, we could be in a lot of trouble.
All right, and we have to end on this, so very quickly, Dr. Goldstein, do we know when this is going to be on the market and how much it's going to cost?
October 17th.
Okay.
I don't know the cost because that's a company decision, but we were told it's roughly what Viagra costs to a man.
Okay, October, we'll be looking for that. All right, Dr. Goldstein, family therapist David Peters, thank you so much.
Thank you very much.
Good to be with you.